Okay, well, good afternoon, everyone, and welcome to this year's annual general meeting of Berkshire Healthcare. This is the first time we've had this online, obviously due to the COVID-19 restrictions, but we hope you'll find it informative and helpful. The meeting is being recorded and will be available on our website from tomorrow afternoon onwards. You're also welcome to ask questions throughout this meeting, which we may not be to answer all of them in the time allocated, but they will be answered and the answers will be placed with the questions on our website from tomorrow. So to kick off, I'd like to introduce a recording of our lead governor, Paul Myerscough, to talk about the Council of Governors update.
Hello, my name is Paul Myerscough. I'm a governor for Berkshire Healthcare Foundation Trust, elected in Reading. As the lead governor, it is my duty to report to you at the annual general meeting. Berkshire Healthcare operates across the county, delivering more than 100 different mental health and community health services. We have 32 governors, half are volunteers elected by people in their areas, and their role is to hold the senior management team to account. Our capability to do this comes from talking to the public and to patients about their experience of the Trust. It also comes from visiting services and seeing and talking to staff at work. We receive reports from management and meet regularly with members of the Board of Directors. And by the way, non-executive directors, who make up a majority on the Trust Board, are appointed by governors. The year ending September 2020 has very much been a year of two different halves. Up until March, governors followed the regular activities that I just alluded to. From the start of lockdown, our scope of operation has been severely curtailed. Like most of the NHS, our Trust implemented a new management structure and way of working to respond to COVID-19. To a large extent, the changes were driven centrally by the NHS, with not much scope for local variation. As far as we can see, our Trust managed well. We know management meetings quickly went online. Meetings were generally shorter, travel time was saved. Board meetings followed, then governor meetings. As part of the National Response Plan, some of the services were curtailed and staff redeployed to those likely to be impacted by COVID. We know many of the services offered support by phone or by video call, and after a month or two, group sessions were being offered online. Governors are very pleased with the flexibility shown in the delivery of patient care. We have asked the Trust, however, to review the effectiveness of this way of working. There is no guarantee that therapy delivered by video produces the same outcome as a face-to-face session. The Trust is again following national directives in reopening services. We are keen to understand the effect on costs and on waiting times. We know from local organisations and the voluntary sector that demand for support in the community is much higher than before lockdown. It is not clear yet how this will impact the Trust. Berkshire Healthcare sits between acute hospitals and primary healthcare on the one hand, and social services and the community voluntary sector on the other. A natural pathway for many Trust patients leads from one to the other. Late in 2019, the Trust was reviewed by the Care Quality Commission. We are tremendously proud that their assessment gave the Trust a rating of outstanding. Governors see this as a sign of high capability among our senior management and commitment and dedication among staff. We would like to say well done to everyone who has contributed to this excellent report. Of course, governors are not here to praise the Trust or staff, and we hope patients can say thank you to staff for a job done well. As I said earlier, governors are placed in the organisation as a mechanism for local communities to hold management to account. I believe it is part of our role to get a feeling about those aspects of the trust the CQC doesn't necessarily evaluate. We want to see and recognise the areas where could do better is an appropriate assessment, and then we will ask management to focus down on improving the service. We want the high standards of care that is evident in the best parts of the trust to be available everywhere. We want all staff to be valued by management and their colleagues, so that Berkshire Healthcare is a great organisation to work for. Looking forward, governors have several concerns. First and foremost, will we be able to be effective in scrutinising the trust on your behalf? This cannot happen during the current pandemic. Inadequate permanent staffing levels continues to be a great concern and has a direct effect on patient care and morale. And as I outlined, COVID has had an impact, and this will continue. The overall effect of this new pressure on the services has yet to be quantified. The changing health and social care landscape with primary care networks and system working partnerships continues to confound us with lack of clarity about the future organisation and governance structures. Finally, I should say that all governors welcome input from the public and welcome new members to come forward and join us in our scrutiny of the Trust and in playing a part in influencing the future shape of our National Health Service. Please read my written report on governor activities for the last year, which you will find among the meeting papers and on Berkshire Healthcare Trust website. Thank you.
We'll now move on to a review of financial report and future plans, and I'll introduce Julian Emms, the Chief Executive of the Trust.
Hello, good afternoon everybody. Thank you. Yes, we've produced a detailed annual report and also a detailed quality account. What I'm trying to do in the next 5 minutes or so is just give a quick snapshot, a summary really of what the position has been of the Trust over the last 12 months. If you want to know more, please read the annual report. So a couple of things, if we could just look at the slide. We provide the community and mental health services as Berkshire Healthcare across the whole of the county, plus some additional specialist services. So sometimes people get us confused with the Royal Berkshire or Friendly Health. We provide mental health and community services. One of the great things that happened just before COVID really took hold and lockdown was that we had the results of our CQC inspection, if we turn to the next slide. And we've always had a good reputation with the regulator. But I'm absolutely delighted to say that this year we are rated as outstanding for the quality of the care that we provide. And we're also separately rated as outstanding for the quality of the leadership in the organisation. And what I would say is this is a fantastic tribute to colleagues who work at Berkshire Healthcare who've been working really hard on this for some time. And it puts us in a great position as we face the COVID pandemic. So we're in the strongest possible position, and that is credit to the people who work at Berkshire Healthcare. Next couple of slides, if we can show those, are really just some of the quotes from the CQC themselves. So I'm not going to go through them verbatim, but you get this sense of a CQC inspection that found staff to be highly motivated, highly proud of their achievements, passionate about delivering high quality care. And next slide talks about how colleagues were really driving improvements, that there was good trust strategy, a set of values, and that there'd been year-on-year progress supported by really strong governance. So that was a fantastic end to the year. We got that report in the middle of March 2020. Looking back about how well we did during the course of the year, our next slide sets out our priorities, or what we call in Berkshire Healthcare our true north, where we really want to get to. And we have just 4 priorities, or true north priorities: harm-free care, improving staff experience, improving patient experience and outcomes, and supporting financial sustainability, which Alex will talk about in a bit more detail. So the first of these, harm-free care, there's a number of areas that we work on, but again, I'm just giving you a flavour of some of the achievements or some of the areas where we need to do more. So in terms of pressure ulcers, we set a stretching target of no more than 18 category 3 or 4, the most severe pressure ulcers for the year due to lapses in care. If you go back 10 years, there'll probably be 100 or so. So you can really see that year on year we've improved, and we did achieve that target. Similarly, we've been really working hard using quality improvement to reduce falls in the organisation, and we set a target of no more than 4 per 1,000 bed days. So 1,000 bed days is a lot, and that target is way below what most other organisations would be achieving. We didn't achieve it, but we have year on year reduced the number of falls, so we've got a reducing trend, and we have reduced the number of falls by 50% since 2018-19, so really significant work. The next was about achieving a reduction in medication errors, so no more than 4 medication errors resulting in moderate harm, so not severe harm, moderate harm for the year, and we achieved that primarily due to our electronic prescribing has been a great help there. And then a longer term target has been reducing the rates of suicide of people under our care by 10% by 2021, which is actually a national target, and we're on track and stable in terms of that. And then all our services will contribute to an outstanding CQC rating. And as you heard from me earlier, I'm absolutely delighted to say we achieved that. The next is about improving staff experience. Paul talks about vacancy rates and the pressure there. Well, I'm pleased to say actually things have improved quite significantly during the course of this year. Staffing and vacancy rates are probably the best they've been for nearly a decade. Still more to go. But our vacancy levels for the year, we set a target below 10%, and actually by the end of March, we were just under 6% and on a downward trend, which is pleasing. Staff turnover, which is the highest amongst healthcare organisations in the Thames Valley, so the Thames Valley area has the highest level of turnover in the NHS. So we were running at 16%, and we said we wanted to get below that, and we did. 14.9% and on a downward trend, but still for us that's too high, and that's a priority for the coming year. Our annual staff survey, all NHS organisations are surveyed, and we came top 3 in our sector for staff engagement, motivation and engagement, but we know we've got more to do, particularly around colleagues with a declared disability and BAME colleagues, Black, Asian, minority ethnic colleagues, who don't always share the same experience as others. And so that's a focus of work last year and the year coming. And a reduction in patient to staff assaults. Again, it's a real scandal that so many people get assaulted in the NHS, over 80,000 a year last year, and organisations providing mental health and learning disability services account for 75% of those in total. We set a target of no more than 36 per month. It mainly happens in 2 of our wards where we're taking the most disturbed patients. We didn't achieve that target, but we did have a downward trend again, and we did achieve the target in 7 out of the 12 months. Improving patient experience and outcomes is the next area of focus, and again pleased to say that we've got some really good family and friends satisfaction rates, as you can see there. We also targeted mental health delayed transfers of care. In physical health care we'd seen an improvement and reduction, but not in mental health care. I was really pleased to work with our partners that we're able to achieve the reduction below 7.5%. And then finally on this, we'd said in mental health that we would make sure that we had no more than 2 cases of prone or face down restraints per month. We had a couple of years ago been one of the largest users of prone restraints in mental health trusts, so in the upper quartile, and we've now got to one of the lowest users of prone restraints. So although we didn't achieve our target, nationally we're in the lower quartile for it, and we did achieve it in 6 of the 12 months. So again, a pleasing trend on a stretching target. The next slide is about financial sustainability. Alex will talk more about that, other than to say we did achieve our financial plan for the year. Alex will provide a little bit more detail. My final 2 slides are really about looking forwards, and it's about the use of digital. So the first slide I'm talking about is online consultations, and our Director of IM&T, Mark, will be talking in more detail around digital later. But I just want to say that during the pandemic, our switch to digital has been hugely impressive. And what we have on this slide is the fact that we use 2 platforms. One is Microsoft Teams, which this broadcast is going out on, and also a bespoke platform for healthcare called One Consultation. And we use those in about equal numbers. We've actually spoken to our staff around the use of Microsoft Teams and one consultation as well as patients, and there is a high degree of satisfaction. The telling thing here is that we were using online consultations before the onset of the pandemic. So in January and February, there was online consultations happening, but around 150 a month. And then we hit March, the last few days of March, it's up to 3,000. And then in the height of it, we were doing 16,000 virtual consultations. And of course, more telephone consultations in terms of that. That is a lot of time. And it's allowed us, in those areas where we can't do face-to-face, or it's not desirable to do face-to-face, to continue to provide high quality care. The next slide, and the final slide I want to show, is around not just clinical activity, but the organisation has also switched to digital. So using Microsoft Teams to connect, either to have a call with a colleague or to have a team meeting with your team, has been hugely successful. We were one of the biggest users of Microsoft Teams before the pandemic. So in January and February, 2,000 team calls, 2,500 team calls, 2,500 team meetings over a digital platform like Microsoft Teams, to the extent that Microsoft themselves chose us as a case study in the NHS around December time last year to highlight what could be done by Teams. But you can see that was a drop in the ocean compared to the last few months. We've got 44,000, 45,000 team calls going on and 33,000 team meetings. What that's entailed is that we've stopped travelling. We've saved over $500,000 in travel expenses. We've been able to think about cutting down on buildings in the future and how we utilise our buildings. We've saved an enormous amount of time, and we've been able to provide a much more flexible working offer for many of our colleagues, which have gone down well. We're very conscious around digital exclusion. So we know in Berkshire that we serve a relatively wealthy population that's well connected, but we have a population that we look after that are less digitally enabled. And as a consequence of that, we are working with our partners in the future to make sure that everybody can benefit from this digital revolution. So digital will play a huge part in our care next year, and happy to take any questions later on after Alex talks us through the financial review for the year.
Thanks, Julian. So financial review for 1920, that is the financial year 12 months to the end of March 2020. I've got two slides for you to summarise the financial results of the Trust. If we go to the first, please, which is our income and expenditure position. So over the last 5 years, we've gone against the grain in terms of the significant financial austerity on public sector in the NHS and have reported small surpluses each year, which is testament over the last 5 years to the excellent financial management of our budget holders and our operational teams within the Trust. And a big thank you from me to all of them for these results, really, because I couldn't have done it without them. We have a net surplus of 1 million reported in the accounts for 1920. When you take away a technical adjustment that's called an impairment on our asset values, we in fact achieved our plan. And as a result of achieving our plan, we've achieved central funding of around 2.8 million, as we did last year, slightly less than last year, which is the main reason for the difference in surplus results between the 2 years. There was more bonus funding for performance to the NHS around our control totals in 1920. So underpinning our overall performance in 1920, we achieved cost savings of nearly £5 million recurrently, so ongoing, not just one-time savings, which has been a challenge for all NHS organisations. So again, in the face of very difficult financial settlements for the NHS, we've been able to identify efficiency savings that have not impacted quality and in fact, in most cases, improved quality of care, which is the balance we want to achieve. Our temporary staffing costs and our pay bill have been well managed, although there's been a slight increase in temporary staffing costs. Within that, we have again year on year reduced our agency usage by 1.1 million, which is great. And we have quite a low percentage of our pay bill is now on agency staff. And as you can understand, we want to try and recruit and retain as many substantive staff as possible, recognising we need to manage our operations with temporary staffing to support shifts and ways of working. But we'd like to do that with our own bank staff rather than agency staff wherever possible. In terms of a regulator perspective around our financial risk, we've achieved the best financial risk rating of 1 for the year again. and from a regulator perspective, that indicates lowest risk of financial failure, very financially stable, and good sustainability prospects going forward. Can we go to the balance sheet page, please? So just want to highlight here, good liquidity in terms of that £26 million cash balance. What that cash balance has allowed us to do is invest quite significantly actually in the last year in our estates and our IT infrastructure and IT services. And you can see from Julian's slides that we've just seen around remote consultation, the use of Microsoft Teams, without the investment in the IT infrastructure in both network capability and the software, we wouldn't have been able to flip very significantly and transform the way we work as a result of the pandemic. So it was really good to be in that position as a result of that investment. Those are the highlights of the 1920 financial position, and as with Julian, I'm happy to take questions after this slot. Thank you.
If you could just unmute yourself there for me, Martin.
Thank you very much, Alex and Julian. We've had some questions in which the moderators have responded to, some of them, one about staff assaults, one about agency, lack of or stress of nurses. There's just one which I wondered if we might touch on, which is about health and well-being in mental health in Wokingham. Despite its place on the health and wealth spectrum, Wokingham seems to have a high incidence of depression. Is action being taken on this to support and enable primary care, as the incidence is likely to increase due to COVID? Is that one, Julian, you could take?
Yeah, of course, yeah. I mean, we're probably realistically, because not only of COVID, but the likely recession, expecting an increase in demand for our services. Exactly the size of that, we're not quite sure, but certainly levels of anxiety and depression we anticipate going up. The main service that will deal with anxiety and depression is our talking therapist service, or improving access to psychological therapies. That's a nationally mandated and rolled out service. In Berkshire, we've got a very good one. To give you an idea, 1.2 million individuals were seen by talking therapies last year across the UK, tens of thousands in Berkshire. There's been additional investment put into talking therapies service, including in Berkshire, where we expect to be able to increase our capacity by a further 10–15%. So whether we'll be able to meet the demand, I'm not quite sure, but we'll certainly be able to meet increasing demand, including in Wokingham too. And we're able to do that for a variety of platforms, face-to-face, digital, online, etc. So yes, in a nutshell, we do expect to be able to deal with increased levels of anxiety and depression within reasonable limits.
Thank you very much, Julian. One more from Anne H. Whilst there is much to be applauded in the development of remote working capabilities, how do you plan to address the needs of new staff or younger staff who need a focus on learning and development? Jane?
Yeah, I can certainly answer that. So actually, although we have moved to remote working, we actually have continued to provide learning and development throughout the COVID period. What we actually did was pivot our training, so where possible, all our training and our learning has gone online, and that is training and development that can't go online, and we have continued to offer, but through ways that are socially distanced, or it's a little bit more safe in order to be delivered safely, and we're not putting our staff at risk.
Thank you very much, Jane. And Jane is the head of HR and the trust.
Martin,
I think,
Martin,
yes?
can I just answer, just expand on a question where there has been a reply to Jane, which says, from Caroline, says 36 assaults per month sounds dreadful. What do you think is causing? They're surely not all drunk, are they? The reality of it is that the majority of assaults take place on two wards: Sorrel Ward, our psychiatric intensive care unit, where we take in the most disturbed patients, often psychotic, or sometimes transferring from prison, and Camping Unit, which is our behavioural unit for people with learning disability and mental health issues. And by definition, they're admitted there because they have significant behavioural disturbance. That doesn't mean you can't do anything about it. And then we have a number of assaults, particularly on our older people's wards, where people might have dementia. And again, they may not have capacity and aware of what they're doing. And again, there are things that we can do to reduce those things. So just to give you a context behind those assaults, they become in a variety of ways and a variety of solutions to them. So and the variety of severity. So I just thought it was helpful to explain where they came from.
Thanks so much. And there's one more that I think perhaps Jane could take from Karen. Have you done any research into what would keep staff and reduce staff turnover?
Yes, people here will laugh because that's one of the pieces of work we've done a lot of investigation on in the last few months, and it's actually the focus of a lot of quality improvement work that we have been doing, and will form the basis of some of our new people strategy, which we're developing on the back of the new trust strategy. So yeah, we actually know that there are two big areas of concern that we are focusing on, and that is primarily around things like career opportunities, that people will leave for career opportunities in many cases. And also what they're saying is work-life balance. And again, as I say, there's a big piece of work to try and understand how exactly what people mean and how we can resolve that in a way that helps our people to get the career opportunities they want and to get the work-life balance that they want as well.
Sorry, Martin, if you could unmute your mic for me, please.
I think we're now moving on to the time for our two presentations. Thank you for the questions. Please do keep asking them. As I said at the outset, all the questions will be answered and the answers placed on our website tomorrow. So now let's get on to two presentations. The first, you'll get some time to meet some of our amazing volunteers, and our Queen's Award Volunteer Service is going to be introduced by Natalie Zacharias, the Deputy Director of Allied Health Professions. Natalie, over to you.
Good afternoon. Overseeing the volunteers is without doubt the best part of my job. Berkshire Healthcare is in a really strong position to employ and support its own workforce of volunteers, and 5 of them have come together to make this film for you to give you a flavour of the different roles that they hold in the Trust.
We've got over 180 volunteers working across our site in a huge variety of roles. We are very grateful and proud of our volunteers. They are indeed the very best team this year, and they've been royally appreciated. They were awarded the Queen's Award for Voluntary Services. This is the award which is given for outstanding achievements to groups of volunteers who regularly donate their time, skills and energy for the benefit of others. And we're very proud of them, and it is justifiably so that they won this award. So I'd like to say thank you to all the volunteers. We're very, very happy to support them.
My role as a volunteer before any of this happened, before the coronavirus kicked in, was to walk Bella around the West Berkshire Community Hospital ward. She was a therapy dog. When COVID came, everything stopped, all the therapy work stopped. But then I volunteered to become a delivery driver. And I started off with some medicines, and then I worked for Westcall, which was dealing with all the PPE stations, and started delivering PPE gear to them as well.
My role as a volunteer is that I volunteer at Prospect Park Hospital, working with different occupational therapists in the team, and seeing how they, what kind of activities they choose for the patients, what they do. We've also been out for little walks in the grounds, has taken the patients, if they're at the right stage, to the nearby supermarket so they can actually get used to choosing items, buying them and paying for them and walking back. It's just helping them get back into daily life, after their spell in hospital. I introduced a new activity. I spoke about it with the OT team, and it was called the Tower Turfle or Magic Table, something I'd read about for dementia patients, and it was really great that they actually eventually did actually implement that, and that's now being used there in in the dementia ward at the hospital.
My role as a volunteer was to help run groups for the Oxford Recovery College in Maidenhead. Those groups were for people who were suffering poor mental health in the local community. And we covered everything like craft days, creative writing, how to get a good night's sleep, and everyone really seemed to enjoy the groups.
I co-lead a team that maintains and develops the therapy garden at West Berkshire Community Hospital. And I've been doing this now for 7 years. Our church was looking for a project in the community that we thought we might be able to do something really useful in, and matron told us about the piece of land that they had at the hospital, which had been designed to be a therapy garden, but they hadn't been able to find anybody to maintain or develop it. And over this period of 7 years, we've been able to design this garden and divide it into areas. So recently, we've set up a rainbow garden because 2 of the palliative care suites at the hospital overlooked the bins, which was very upsetting for the staff.
I'm a volunteer at West Berkshire Community Hospital. My husband was in the hospital in Donington Ward for 3 months, and I was going backwards and forwards daily to see him. And there were other men in the ward that didn't get visitors, and if Bert was asleep, that was my husband, was asleep, I'd go and talk to them. And they used to say to Bert, "Is your wife coming today?" Because they didn't get visitors, so I go and talk to them. And that's how that started. But I was also going backwards and forwards because I had an operation on my foot. And this was after my husband died, and one of the nurses said to me, "I've been asked if I saw you again, if you do some voluntary work here." "What can I do?" I said, "I've been a secretary all my life." I said, "I can't see now. I'm blind." They said, "No, we've understood that, but we want you to go and talk to patients." I said, "Well, I thought you were going to say, take the tea trolley round." I said, "Because if I was going to do that, send somebody with a bucket of water behind me, because you need to mop it all up." It was suggested that I did a couple of months to see how it got on. 4 years' time, I was still there.
And the reason I wanted to do volunteer work is because being an ex-sufferer of mental health myself, I found that helping other people helped me as well. So I guess you could say that I found a way forward for me through helping others. I really enjoy it because I like meeting different people, and there's a real sense of achievement as well when you get a feedback form back and someone says, "I've really enjoyed the course, and I've really got something out of it." That's a real plus.
I wanted to become a volunteer in a healthcare setting for a few reasons. I'd lost my parents, and it was just something that I felt was quite good to give something back. I've really enjoyed being a volunteer in the different activities I've done. And I think it meant something to try and help people directly.
What made me decide to become a volunteer was basically my wife was diagnosed with cancer back in 2013. She had pancreatic cancer, and unfortunately in 2016 she passed away. But it's the help that other people gave her and me during this time. And it was at the Duchess of Kent Hospice where she spent her last couple of weeks. And I always took Bella in, who's obviously my dog, and they said that she would make an excellent therapy dog.
I would say to anyone who's thinking about volunteering, give it a go. Just give it a go. We have a very diverse team of people, and we just love being together, and we've gained so much from our friendships with one another.
Just do it. It's so rewarding. You'll never, ever regret doing it. I really can't understand why there's such a much fuss made, because there's reward enough from the patients. They're lovely.
Anyone who's thinking about being a volunteer, I can only highly recommend it, because it doesn't just help people that you're volunteering and helping. It helps you as a person, helps you grow, helps you give you confidence, and it just makes you feel really proud that you're giving something back to the community. And it's such a good feeling to be a volunteer. I think it's probably the best thing I ever did. And anyone thinking about it, I'd just say, go for it.
Due to the risks of COVID-19, in March this year, we had to review all the volunteer roles across the Trust to ensure the safety of our volunteers, and we had to step down any of the volunteers in the at-risk categories or in roles that were patients and staff facing. This was unfortunately the majority of our volunteer workforce, and only those volunteers that could continue to work virtually, such as our Sharon moderators and the health makers, continue to stay in their roles. We remain in contact with all the volunteers that we've stepped down because a number of them are shielding and socially isolated themselves, and we'll return them to their roles as soon as it's safe to do so. At the same time, we developed 3 new roles to help support our clinical teams through COVID, and they included wellbeing calls for patients that were perhaps sick, having less face-to-face contact with their normal services, or those socially isolated. We had a driving role, such as Barry, delivering medications to care homes and PPE around the Trust, and an administration role. We were overwhelmed with the response from the public to come and volunteer for us in that time, and we recruited an additional 70 volunteers, mostly people that had been furloughed from their own work, and 45 of our existing volunteers that couldn't do their normal role stepped up to help out with the new roles. We are starting to reintroduce volunteers into our clinical services, going through a process of risk assessment of them and the role to make sure that we keep our volunteers, staff and patients safe. We would really like to thank every single one of our volunteers for all the time that they give up to help support our services, and congratulate them on the huge achievement of the Queen's Award.
Natalie, thank you, and a very impressive film about the work of our volunteers, and I'd like to add my thanks to all the volunteers for all they do for our patients. We now move on to the second of the presentations, which is Leading the Way with Digital by Mark Davison, our Chief Information Officer, where he'll tell us how our investment in digital technologies has enabled us to deliver continued good quality care to our patients during this COVID pandemic. Mark, over to you.
If you could unmute your mic for me, Mark.
So I'd just like to give you a quick tour of all the work we've been doing in digital. I think you've already heard from Julian and Alex of a number of things that have impacted and helped us deliver outstanding quality care this year. For us, our strategy was really to make sure that digital had a role to play in delivering care at scale and providing 7-day services. Jason, could you skip on a slide, please? It's been a journey of small changes, and our aspirations have been made based on what our stakeholders, so both our staff and our patients, keep clicking, Jason, thank you, have been telling us. Next slide, please. So as part of that work, we've completely changed our digital infrastructure, and our mobile working, as you've seen already, enables efficiency benefits and has been enhanced by the extended use of video conferencing, which is reducing avoidable staff and patient travel. Our single patient record system supports more informed and safer care. The new and faster and secure networks and devices for 5,500 staff have enabled us to lower our operating costs, work flexibly from anywhere at any time, and strengthened our cyber security defences, protecting our patient records and connecting our patients and staff. Pre-COVID, over 1,000 patients a day were accessing our Wi-Fi services, and during the COVID pandemic lockdown, we were able to help keep our patients in touch with their relatives through the use of that same technology. Next slide, please. And one more click. Digital enabled transformation at its core is a desire to deliver high quality, person-centred and coordinated care. For our patients, we're providing online therapeutic networks, online therapies now supporting 2,000 therapies a month, virtual consultations since April. We've delivered over 70,000, and our online portal keeps patients in touch with their appointments and timings, now delivering over 250,000 digital appointment reminders and letters. Our online services, which help patients to look after themselves and get ready and speedy access to ourselves and our clinicians, is now accessed over 500,000 times a year. In the community, in our ward, 20,000 physical observations are now digitally recorded across a range of assessments, which have improved our patient safety by ensuring problems are quickly escalated to senior medics at the right time. Our bed management and patient status boards provide up-to-the-minute information to get us the right treatment to our patients as quickly as possible and reduce the incidents where we need to transfer patients to another hospital. There are now over 60,000 mental health inpatient prescriptions every year and 150,000 administrations of that medication. It's all now digitally monitored and delivered. Our live patient safety and monitoring and alerting apps notify our staff of significant patient events, from potential falls to being overdue for returning to the ward from short-term leave. Next click. In our community, active alerting is keeping our staff up to date with other significant events in other settings. So when our patients are admitted to A&E, or there are changes to risk ratings, which are notified before the staff attend the patient's home. This has resulted in a 40% reduction in failed home visits for our CRHTT and community teams, and goes a long way to improving the work-life balance for our staff. We've created shared digital care pathways, and it's giving us an opportunity to identify and reduce variation in our standards of care, and helps to guide our staff on which protocols and activities need to be provided next. Using our mobile technology and enhanced care home support enables our in-reach services to have fast communications to community support teams and access to shared records in the nursing homes. Our mobile workforce now have the tools they need to provide safe and effective care when visiting patients at home, and can order any diagnostic test they need. Next click. We're also using the information we have collected to be able to predict when our services will be needed the most, and to ensure that we can continue to deliver outstanding and timely care. Next slide. One of our other digital aspirations was to deliver shared care records across the geography. So to 1 million patients in Berkshire, we're now very pleased to be part of a consortium of organisations, from hospitals to GPs to social care workers, which share health and care records. Our staff are accessing nearly 15,000 of those records every month to help give the best possible care for our patients. It enables us to see the opportunities for delivering new models of care, and provides clinical quality and efficiency benefits for both our staff and patients. We're able to see what medications are being prescribed in whichever setting a patient's been in, and finally we can join up care across all of the differing health and care sectors. During COVID, the rich analysis capabilities have allowed us to provide local insights to the population and combine health and social care data to reach the most vulnerable as quickly as we possibly can, and to ensure that our resources are targeted appropriately. Thank you. That's a very quick tour of the amount of effort that's gone into digital services within the Trust over the last 3 years, and we're very pleased to see the amount that patients are feeding back in terms of their satisfaction of those services. Thank you.
Mark, thank you very much indeed for that presentation. I think the development and deployment of our digital processes has been most impressive. I wanted just to thank everyone for taking part in this. This has been an eventful year for the Trust, with the pressures of COVID-19 and the joy of the CQC outstanding assessment. All COVID-19 and continue to do, and also to invite all members of the public to take an interest in the trust, to become members if you're not, and maybe become volunteers, and you've seen the excellent work our volunteers do. So thank you very much for joining us. Good afternoon.